Welcome to Birds.Bees.Bodies, a Planned Parenthood of Southeast and North Florida podcast where we break barriers, tear down stigmas, and promote open discussions on sexual and reproductive health. Get the buzz on topics from puberty to menopause, contraception to conception. No topic is off limits. So sit back, relax, and let's dive into a judgment-free zone to promote sexual wellness.
All right. Welcome to another episode of Birds.Bees.Bodies, Planned Parenthood of Southeast and North Florida podcast. We are so excited to host another episode. Today, we're talking about vaginal health. And of course, the title of our podcast is How to Take Care of Your Kitty, right? So kind of cute. I'm Michelle Quesada. I'm the VP of Communications for Planned Parenthood of Southeast and North Florida. We have Clara Truyenque, a co-host, our communications manager as well on the call today, and Dr. Daniels, a physician with us at Planned Parenthood. Dr. Daniels, if you want to give a little background about yourself.
Yeah. Hi, everyone. Thank you so much for having me. My name is Chelsea Daniels. I'm a staff physician with Planned Parenthood of Southeast and North Florida. I'm relatively new to the affiliate in the last year or so. Prior to this, I was working and training in North Carolina. And I was working up at Planned Parenthood up there as well. So I have been in the Planned Parenthood world for some time, but it's a pleasure to be here. Thank you so much.
And we're so happy to have you. Dr. Daniels is amazing at just sharing education, spreading awareness. And one of the topics that we have really wanted to talk about for a while is vaginal health. And honestly, very timely, right, Clara? Because you brought up the TikTok trends that we saw recently about cleaning your vagina and what you should do. I mean, I won't go into detail on how those conversations started.
No, that's true. Actually, many people ask us on social media about how to take care of your vagina because there are tons of how to say this, tons of questions that people ask Google, and you never know. If you ask Google, you never know if you are finding the right answer. It's better to ask a provider, right? So that's why we have Chelsea today, Chelsea Daniels. Yeah. So we can ask you all kind of questions about this.
And I guess before we get into all things keeping your kitty healthy, right? I think most people don't even know how do you even gauge vagina health? How do you measure vagina health? So maybe we can start there.
Yeah, it's a really good question. And I think that kind of like what you were talking about on TikTok, I get asked this all the time, even if it's not a visit that we're intended to be talking about vaginal health. People will mention to me like, hey, can you take a look at the smell, or it's looking funny? So this is coming up on a daily basis for me. And I think also to your point about TikTok, it's because here comes my cat. Here we go. It's because people are really confused, and there's so much misinformation out there. And I think that there's this idea that like your vagina should smell like a rose all the time. And so if it doesn't, then there must be something wrong. So I think the first thing that I always say is that knowing your vagina is key. Every vagina smells different. Every vagina has different cervical mucus patterns. And so if you feel like it's a deviation from your normal, even though it could be more similar to what your friend's normal is, for example, that is still a deviation for you. And that is really important. So you will get to know kind of the consistency of your mucus, what your vagina smells and looks like, and just kind of developing that comfort is really key. So anytime, though, there is any kind of change in smell or mucus or like the texture of the mucus, the color of the mucus, that's a reason to come in and talk with one of us or talk with your regular doctor. And then similarly, any kind of abnormal sensation. So if it's painful or if it's itchy or if there's burning, anything that feels just new and different that you've not experienced before is just kind of an easy way to kind of have your finger on the pulse of your vaginal health.
And there's different things, right, that can impact that. I mean, I know your vagina health, what your cervical mucus looks like throughout your menstrual cycle, for example, can be different.
Yes, I have, for example, a question that comes up when we work out a lot. Most of many women that I know, right? So, for example, if you work out a lot and you are on sweaty clothes a lot, how does that, and also your diet or lifestyle, how do all these things impact your vagina, your vaginal health?
This is a good question, and this is also a source of a lot of misinformation. So working out in and of itself obviously has a ton of benefits, and it makes you really healthy, but it shouldn't directly impact your vaginal health. So it's not like your mucus in and of itself should change because you're running a lot or something. However, some people are really sensitive to sweat and sitting in sweat. So there are people who can go for a 10-mile run and then sit at a restaurant for 3 hours and have a leisurely coffee with friends and be fine. There are other people who can go for a 10-mile run, sit and have a leisurely lunch with friends for 3 hours, and then the next day their vaginal health can take a hit. And it's not because of the literal exercise, it's because your vagina and the all of the mucous membranes, all of the cells in your vagina, if they're sitting in kind of a warm, sweaty environment, it can sometimes impact the bacteria that are growing, the good and the bad bacteria, and the smells that everything produces. It's kind of the same. You can think of it similarly to like our armpits or the skin under our breasts, right? Anytime that there's like a warm, sweaty, sticky environment, smells can be produced. And some people are going to be more sensitive to that than others, for sure. And so when I see patients who are having recurrent problems with their vaginal health, or coming in and saying, I'm always smelling, or I'm always noticing XYZ pattern, that's one of the first changes I mention. When you go to the gym, come home, get out of your clothes right away and take a shower. You don't want to be sitting in your sweat if that's a trigger for you. And it's the same premise with like bathing suits. So if you are sitting in a wet bathing suit all day, for some people, that's a really big trigger. And then similarly, lots of people are sensitive to certain fabrics. So I always recommend for people who are more sensitive, cotton underwear. And you'd be surprised if you look at the label on your underwear. So few of our underwears are actually made of cotton. And so people who are, again, sensitive, and this is not everyone, but if you are someone who's like, I always feel like I smell and I'm really self-conscious, getting cotton underwear is huge. And then to your second point, the diet thing. Oh gosh, this comes up all the time, all the time. And most of it is not based in evidence. There are some really, really weak trials out there that will say that, there might be a correlation between diet and rates of bacterial vaginosis, for example, which is a specific type of vaginal infection that we can see. Or changes in discharge related to what we eat. But we don't really have good evidence as of this moment to recommend a certain diet, one over the other. So you're going to see online all the time, plant-based diets are better for vaginal health. Here comes my cat. Plant-based diets are better for vaginal health, or low sugar diets are better for vaginal health. And we don't really have the science to say that that's true.
I'm glad you brought that up, because one of the things that I've heard a lot from people over the years is, oh, if you're getting a yeast infection, it has a lot to do, you're eating too much bread, you're eating too much wheat, like you're eating all this stuff. And I'm like, wait, is that real, or is that just a misconception?
Yeah, I mean, I think there are people out there who have, for example, really horrible, poorly controlled diabetes, and so they're just have a lot of sugar in their body, which means that there's sugar in everything that their body produces. So their urine is sugary, their vaginal discharge is probably more sugary. There's just like a sugar-rich environment, and in those cases, maybe we see more correlation. But for like your average person, if you have a slice of cake every day for 2 months, I mean, you're not really, assuming you have normal sugar metabolism, there's just really not data to say that that's the case. So I think that this is like TikTok misinformation, but I also think it's like misinformation that's often propagated about women's bodies because it makes us feel like shameful and like we're out of control of our bodies. And the fact of the matter is that if you are having like slices of bread or the other things that you recommended, you should be fine. There might be people out there who really are sensitive, but there's so many factors to vaginal health that to be able to say it's because of your diet, we can't say that.
Yeah. And I know we talked about hygiene at the beginning of the call, but that's one that comes up a lot too. There's so many scented soaps out there, and like, I don't know about you all, but I love my bubble baths and putting in my bath bombs and my oils and all this stuff. But then you hear, like all of that can really mess with the pH balance of your vaginal health. So let's talk about that for a second. What kind of impact can these types of products, of course, using it over time have on your overall pH balance?
Yeah. Unfortunately, there's not a one size fits all with this. I wish that there was. Um, Speaking from personal experience, I have, knock on wood, never had an issue with anything scented or bubble baths or bath bombs or anything. And so it's not something that I need to be mindful of. I can go to Target and get whatever detergent is on sale and feel confident that, I'm not going to get a rash on my skin, and my vaginal health won't be impacted as well. There are people, though, where that's not the case. And so for those people, if they start to notice a pattern, there is like a long list of unscented, kind of for sensitive skin, for sensitive vaginas, list of detergents and things that I will often refer people to. Same with anything that we put in our vagina. So there are certain lubes that will make people's vaginas react differently. But on the whole, a one-off bubble bath for most people is not going to have negative effects on your vaginal health moving forward. Most people's vaginas can kind of rebound from that. But if you're someone who knows scents, or like long baths or certain kind of soaps or detergents make you react, then that's something to be aware of and probably something to be avoided.
Soaps that you just mentioned, what do you think about this? Is it okay to wash your vagina with soap as much as you want? Like, many people wonder if it's not good. And Michelle mentioned it. If it's not good, and if you can even change or alter your pH.
Yeah, good question. This is actually new to me from when I did residency. I had the opportunity to work with people who focus specifically on the vulva, and the vulva refers to not just the vagina, the opening in the hole, but to the kind of whole architecture, everything we see, the labia, which are the lips, everything we see. And the vulva is overall really understudied. So there are only a few people in the country who are really vulvar experts. Where I did my residency, there happened to be one. So I spent a lot of time with this physician in her clinic. And she had just handouts on handouts on handouts that she would give to patients answering questions like this. So everything we've talked about so far, but specifically like how to clean your vulva. So the vagina cleans itself. So really all it needs is hot water. It does not need soap. Obviously, unless you see dirt or something that, would need soap. But in general, there's no reason to be putting soap into your vagina or anything like that, or even kind of in the creases in your labia or vulva. You should use soap in your groin around the vulva, like closer to your legs, but otherwise hot water is all that you need. And for people who are more sensitive, the first thing I recommend is cutting out soap, because soaps can really trigger you.
That's really interesting. So, and I've heard this, from a lot of physicians over the years too, like douching is not necessary. Like, people think, oh, after I go through a menstrual cycle or after I've had, unprotected sex, I need to douche and clean out my vagina. What do you say to that, Dr. Daniels?
I say big no, big thumbs down. I feel like douching has at least fallen out of favor. Like, most people have kind of heard at one point, like, don't douche, but most people don't use soap. And our bodies our vaginas are like really smart. They know how to clean themselves. They've been doing it for like millennia, long before douches and soaps existed in the form that we know that they existed. And so for the most part, we should just kind of let them do their thing. Because the problem is that you introduce a soap, right? You could have a rash, like a red dot kind of rash, but you could also affect the pH. And we talk about pH a lot, but basically what that means is how acidic or basic your vagina is. If you think of something acidic like vinegar, and something basic like certain soaps are more basic. And what that does is allows certain bad bacteria or yeast to grow. So even if you're not getting a rash, you're just kind of slightly affecting what can grow in your vagina.
And how can you find out if you get bacteria or yeast that you just mentioned? Is something is going to hurt? Is something you're going to notice?
Yeah, they present pretty classically. So, like I said, kind of the first point that I made about like learn your smells, learn what your mucus looks like and feels like. And And then you'll have a good idea of when something's not right. So typically the kind of like main things that we see when we think about vaginal health fall under this spectrum called vaginitis, which is just a generic term meaning inflammation of the vagina. And the kind of two biggest ones that I see that are not sexually transmitted, meaning if you didn't get it to a partner, you can't give it to a partner, but it's just a disruption in the bacteria in your vagina. The first is a yeast infection. Yeast is actually a fungus, not a bacteria, and it's present on all of us. It's present on all of our skin right now. It's present in our vagina right now, but sometimes it can go to town and have a little party. And when that happens, you'll start to have really thick, kind of cottage cheese-like discharge. And it does not usually have an odor, but it's itchy as heck, and it also looks noticeably different. You'll see it in your underwear. You'll see it when you wipe. It's going to be thick like cottage cheese. Bacterial vaginosis is probably another common one. Yeast and BV are constantly competing for first place in terms of what I'm seeing more of in a day. But BV or bacterial vaginosis is not itchy, but it is kind of like a thin greenish discharge. Most folks' discharge is more like a clear white yellow. It'll turn a little greener. But the thing that really brings people in is the smell. It's a pungent kind of fishy smell. So I think some of the harms are if you are over washing your vagina with soap, for example, you don't give your brain, your nose, the chance to really get to know what your mucus is like. And so then if it does become smelly, you're not sure, is this a normal smell or is this a bacterial smell?
And typically, if you notice something's off, or even if you're doing a routine test, like, doing a vaginal swab or something like that, a doctor will be able to determine with a culture what kind of bacteria you're dealing with or fungus if it's yeast infection.
Yeah, it's honestly pretty fast. We do a swab in the vagina with just a Q-tip, and then we just take it to the next room and look under the microscope. And you can see under the microscope the bacteria that we would see in bacterial vaginosis or the yeast from a yeast infection. So we can diagnose it within minutes. And there are treatments for both.
Is that typically a routine procedure, not procedure, but exam that you do during like PAP exams, for instance, like you'll also do a swab and check that out?
No, I wouldn't do it routinely or like preventatively. It's only if someone's coming in with symptoms that kind of fit that, because like I said, yeast is in all of our vaginas right now, even if we're not having symptoms. And so probably I'm going to see some yeast at any point, right? But it's about the number of little yeast buds that you're seeing in line also with symptoms in order to diagnose it. There's pretty specific criteria. So I wouldn't preemptively test anyone.
And all these kind of infections and bacteria that you were explaining, should we get worried if we find out we have one of them? So is there treatment that is an easy and effective treatment?
No, I would say not to worry. I don't think I know anyone in my whole life personally or in my career who hasn't had either a yeast infection or a BV infection. They're so common because, the vagina has a delicate balance of what bacteria are growing and all of that. So it is extremely normal for there to be little disruptions. And they're both really treatable. So for a yeast infection, it's one pill, one single time, treats it. And for a BV or bacterial vaginosis infection, it's just a few days of an antibiotic. What starts to become troubling and more annoying and frustrating for people is they'll get in a cycle where they're having, we call it recurrent or chronic vaginitis. So there's some unknown kind of insult or trigger, whether it be they, sat in their exercise clothes for too long, or they're using some detergent, or, God only knows in a lot of these cases, but they get trapped in this cycle where they're having an infection once a month. And they stop responding to kind of the normal things that we're doing. And so that requires a little bit more digging. And there's usually an answer that we can get to, but that's definitely a reason to come to your doctor so we can run additional tests.
What about sexual intercourse? Like, are there certain things that you can be doing, maybe not washing your sex toys correctly, or other things that can cause, infections or like you said, other issues with your vaginal health?
Yeah, this is a good question. And my answer to it is going to be kind of similar to my diet. The answer is that the answer is probably yes, but we don't have great evidence for it. So we don't have great evidence that says that, semen exposure increases the risk of BV. So there are people who think like semen versus condom, like if you're having sex with a condom versus without a condom, having the literal semen in your vagina can impact your vaginal health. In general, there are people who are kind of constantly riding the line and can tip over more easily. So whether that be sex or like a sex toy that hasn't been cleaned well, or having a period. And so if you're one of those people who's going to always kind of towing the line, it could be that one of those little insults, as we call them, like environmental triggers, could cause it. So I think sex with or without a condom, we don't have evidence for. Like, is it semen that's the trigger, or is it just this kind of like external thing caused by sex itself? I don't have a great answer. So
But
it is.
lube could impact depending if you have a sensitivity to certain lubrication.
Yeah, definitely. It's kind of just like if you're someone who maybe has the proclivity to have more of these infections. Like if you know this about yourself, I'm always getting sex. I'm always getting.
I don't think people will say that's a problem.
Yeah, I know. I'm always getting infections after I use this vibrator. Well, there could be something in the vibrator, right? Like, and there are people who are just always kind of towing that line. There are other people who don't have those problems, and it's, we don't totally have a great understanding of why that is. But I would see a doctor before you make changes, because I would hate for someone to listen to this podcast and be like, oh, I do every time I use this vibrator, I get an infection. I guess I can't masturbate. Like, that's not what I want people to take away from. There are probably really identifiable triggers that can be tweaked just slightly.
Awesome. Well, moving on.
I thought that was my cat.
So normal or not, and we touched a little bit on the discharge, but I want to go back to the menstrual cycle. Like, what is normal to see in your vagina, kind of discharge to see during menstrual cycle, and what's not normal? And I know it varies from before to after your menstrual cycle, period. I mean, after your period.
Yeah, it actually varies every day of the month. That's the beauty of having ovaries, is our hormones change every single day. I remember in college talking about like birth control and how difficult it is, like how much easier it would have been to come up with a birth control for men, because from the time of puberty to the time they stop making testosterone in their 70s and 80s, their hormones do the same exact thing every day of their lives, whereas ours are change every day, every 30 days. And so that is going to be true for our cervical mucus as well. So there are kind of charts online that will get into the nitty gritty of what you can expect day 1 of after your period, all the way up to day 30 after your period. But for the most part, your mucus is going to be thin, white, gray, faint yellow, can be a little thicker to like stringier, kind of like egg whites is often how I describe it. I think the most important thing to know about this, kind of like I'm beating a really dead horse here at this point, but everyone is different. So knowing kind of what is your normal is really important. The other thing is that this can be really easily impacted by so many different things. So if you are on birth control, and depending on what kind of birth control you have. So for example, folks with an IUD, myself included, your discharge your mucus becomes really like thick and stringy. And that doesn't mean you have an infection. It means you're on birth control. After sex, your mucus can change a little bit. So there, all kinds of reasons, but in general, it should be odorless or just like a really mild odor and it should appear kind of like white, filmy, egg white color.
What about age? Because I also hear from like so many women or people with vaginas that when they reach menopause, for instance, like their vaginal health changes as well.
Yeah. So this is like the beauty of or the curse of having ovaries, is that when you start going through menopause, all of your ovaries, the estrogen levels decline. And estrogen is a big player in what our mucus looks like. And so that's why I often see patients who are going through menopause or have gone through menopause. And when you have less estrogen, you're going to produce less discharge. And so you can feel drier overall. Because I think what we often don't realize is that, imagine if you like didn't produce saliva in your mouth, it would feel cottony and tight, and you would have cuts and cracks, and it can be really uncomfortable. And it's the same in the vagina. If there's not enough mucus in the vagina, it can feel cottony and cracked and all those things. So for a lot of people, when they go through menopause, as their discharge decreases, which is going to happen naturally, lots of people will have trouble feeling really dry and uncomfortable.
Anything that you hear come up a lot with patients, questions that they have?
Yeah, I mean, I think the couple biggest things that I would take home is, or that I always try to remind my patients of, is there's so much, I think, misinformation about the vagina and fear around the vagina. So if ever I'm prescribing a medicine that needs to be put in the vagina, for example, people look at me as if I have as if I have 7 heads. Like, they're so afraid to touch their vagina, put things in their vagina. And I wish that we could all get really comfortable with our vaginas, because the world would be a better place and your vaginal health would be better, because you would understand it and you would know when it's different. So I think, like, yeah, get familiar with your vagina. Like, take a mirror, put your fingers inside, know what it feels like, know what your mucus looks like, know what you smell like. It's really important. And also know what it looks like, because going back to kind of the vulva, is everyone's labia look different. There are 2 kinds of labia. There's so much variation, and there's usually nothing wrong. It's just your body. And so knowing what your body looks and feels like is really important. And then the second thing is, oh my gosh, please, no TikTok, no TikTok.
Yeah.
Every day I have a patient.
For sure.
Sorry, what was that?
That can send you down a rabbit hole for sure.
Every day I have a patient where I'll tell them something and they'll look me very seriously dead in the eye and said, well, I heard on TikTok, blah, blah, blah.
Of course. And by the way, now that you mentioned TikTok, how about, because I have seen videos on TikTok, and not one, but multiple, how about using baby powder when you have some itching down there, your vagina? And many people say you put the baby powder and it calms the area, right? But is that okay? Is that not good? What do you think?
I would say no. I would not put anything. No. Like, we shouldn't, if we're not using, regular Dove soap, we should not be putting baby powder, because that can be so irritating.
Well, this was a really great conversation. I hope everyone took something from it. We're going to continue to have great conversations like this about sexual reproductive health down the road. If you want to learn more or just get more of our Planned Parenthood of Southeast and North Florida content, you can follow us on our social channels. You can go to our website, ppscnfl.org. Thank you so much, Dr. Daniels, for being a part of the discussion, and Clara, as always, offering great questions and just great comments overall. Learned how to take care of their kitty. All right. Have a great day, everyone.